Infective endocarditis, understanding bacterial heart valve infections. Infective endocarditis is a serious cardiac infection affecting the heart's inner lining and valves. This condition requires prompt recognition and treatment to prevent life-threatening complications. Infective endocarditis represents a serious and potentially life-threatening infection of the heart's inner lining, known as the endocardium. Most commonly, this infection targets the heart's valves, which are responsible for maintaining unidirectional blood flow throughout the cardiac chambers. The condition develops when harmful microorganisms, typically bacteria but occasionally fungi, enter the bloodstream and establish themselves on the valve surfaces. Once these pathogens colonize the endocardial tissue, they multiply and form vegetations, collections of infected material composed of bacteria, fibrin, and platelets. These vegetations can cause significant damage to valve structure and function, potentially leading to severe cardiac dysfunction. The development of infective endocarditis follows natural heart valves and prosthetic valves that involve both microbial factors and host characteristics. Microorganisms access the bloodstream through various routes, including poor dental hygiene, intravenous drug use, invasive medical procedures, or wounds. Once circulating in the blood, bacteria encounter the heart's endocardial surface, where they can adhere more readily if the tissue has been previously damaged. Pre-existing heart conditions such as valve abnormalities, congenital heart disease, or recent valve surgery create an environment particularly susceptible to bacterial colonization. The adherent bacteria secrete substances that help them evade the immune system while simultaneously damaging surrounding tissue. Over time, the infection triggers an inflammatory response characterized by the accumulation of immune cells around the infected heart valves or previous valve replacement tissue destruction and the enlargement of bacterial vegetations, particularly complex structural abnormalities. intervention potentially benefits